Although diabetes has no cure, you can take steps to manage it and live healthy with no or very minimal complications.
3 items play a pivotal role in managing diabetes: medications, diet, and exercising, or being physically active. If we are to anticipate best outcomes, then this combination must be maintained intact.
For type 1s, because their pancreas isn't producing enough insulin anymore, they will now be depending on injecting themselves with insulin daily for survival. The technique of injecting oneself is important. It can determine the effectiveness of the injected insulin and make it painless if done properly. Wash your hands first. If the insulin looks cloudy, mix by gently rolling it between your hands about 20 times. Never shake it. But this step can be skipped if the insulin looks clear. Clean the injecting site. If you are using a syringe for easy withdrawal of the insulin, first inject air into the bottle equal to the amount of insulin you wish to draw. Then tilt the bottle up and draw the right dose of insulin by slowly pulling the plunger, making sure there are no air bubbles in the syringe. Otherwise, repeat the withdrawing process until no air bubbles are seen. Pinch enough flesh to avoid injecting in muscle in any of these areas. Inject straight through, not at an angle, and once in, hold and count from 1 to 10 to allow all the insulin to be absorbed. Then you can pull it out of your body. If using a pen, attach the needle by screwing it in and remove the cap. Dial up to 2 units and push the plunger to make sure there is no air and that it's working well. Make sure you set the right dose before injecting yourself. Continue as if you are injecting using a syringe. Avoid injecting at the same position, as this may cause lumps, which prevents effective movement of insulin to the body. Say your belly is your favorite place, then rotate injecting sites, making sure you put 2 fingers between previous injecting site and the next one going around the navel. Once opened, insulin should be stored at room temperature or in fridge, not in freezer. If you don't have access to a fridge, some put it in water, but there is a proven alternative: use of a clay pot. It's a good fridge replacement. Take a clay pot, put sand inside, keep it dampened by adding water, then add insulin, put in a small clay pot, and put the whole set on the floor.
For type 2 diabetes, one will be taking pills throughout their lives. However, if you develop side effects to the pills, notify your doctor or visit the hospital immediately for alternatives.
Initially, I was given metformin, which pills, yes. I couldn't stand them. Even the mentioning of the name right now affects me because it caused running tummy, nausea, loss of appetite, and until eventually I graduated into, insulin injection.
Later, to some, insulin may be added on top of the pills or replace the pills depending with the dynamics of the disease.
Special care has to be given to the medications so that they remain effective.
For the drugs, we don't encourage again to put your tablets on excessive temperatures. We should maintain room temperature by putting our drugs in our pocket, bags, or in drawers where the temperatures are not very high. We discourage putting either insulin or the drugs on the dashboard or in the front seat in your car. Why? Because there's a bit of high temperatures at the front seat than at the back.